Administration pledged to strengthen the collaboration between the Family Council and Children's Rights Forum review to enhance the promotion of child's rights. Thank you.
Questions. The first question, Dr. Vincent Fang. Mr. President, the Medical Council of Hong Kong, or MCHK, has recently been criticized for its tardiness in handling medical complaints. There is also public criticism that although it was founded to assure quality in the medical profession for protection of patients and foster ethical conduct of medical practitioners, MCHK acts like a trade union aiming to protect the interests of members of the profession, especially in considering limited registration of overseas doctors. As such, there have been increasing calls for a comprehensive reform of MCHK. It is learned that some years ago, MCHK submitted a reform proposal to the government which included increasing the proportion of lay members with a view to enhancing its independence, but the proposal ended up with nothing definite. Recently, the MCHK submitted a proposal to reform itself to the authorities. In this connection, will the government inform this council of the main content of the reform proposal submitted by the MCHK recently to the authorities? Apart from the proposed increase in the number of lay assessors, whether the reform proposal contains any suggestion for the adoption of equal numbers of medical members and lay members similar to that of the General Medical Council in the United Kingdom. If not, the reasons for that? Number 2. The MCHK increased the number of licensing examinations for medical practitioners from once a year to twice a year, but the Medical Registration Ordinance stipulates that the validity period of limited registration must not exceed 1 year. Whether the government will introduce legislative amendments to relax such provision and urge the MCHK to grant registration with a longer validity period. If it will not, the reasons for that? And given that overseas medical practitioners are employed by the hospital authority under 1-year contracts only, of the authority's plan to attract overseas medical practitioners, in particular those with international reputation, to practice in Hong Kong under limited registration. And 3, of the amount of resources provided by the government to MCHK annually. Given that MCHK will need additional manpower and other resources in order to enhance its operational efficiency and transparency, thereby upgrading its standard of professional regulation, whether the government has any plans to provide additional resources to MCHK. If it does, of the details; if not, the reasons for that. Secretary for Food and Health. The Medical Council of Hong Kong, MCHK, is an independent statutory body established under the Medical Registration Ordinance for handling matters relating to the registration and regulation of medical practitioners in Hong Kong, including the conduct of inquiries and disciplinary proceedings concerning the professional conduct of registered medical practitioners. The MCHK handles complaints received against registered medical practitioners, conducts investigations into allegations of professional misconduct, and takes disciplinary actions in accordance with the procedures laid down in the Medical Registration Ordinance and the Medical Practitioners Registration and Disciplinary Procedure Regulation. Upon receipt of a complaint concerning the professional conduct of a registered medical practitioner in Hong Kong, the Preliminary Investigation Committee, or PIC, of the MCHK will conduct preliminary investigation into the case. If the PIC determines that there is a prima facie case, the case will be referred to the MCHK for a formal disciplinary inquiry. The PIC comprises 7 members, including 1 lay member of the MCHK. The quorum of the meeting convened for the purpose of conducting a disciplinary inquiry is 5 members of the MCHK, including 1 lay member. Currently, the MCHK has 4 lay members who take turns to perform their role in preliminary investigations and disciplinary inquiries. In a bid to expedite the complaint handling process and inquiry proceedings so as to cope with an increasing number of complaints, the MCHK suggested in June this year to increase the number of lay assessors and allow them to substitute lay members of the MCHK in forming the quorum in preliminary investigations and inquiries. The proposal does not involve changing the membership or composition of the MCHK. The administration is actively considering MCHK's proposal. Number 2, according to Section 14A of the Medical Registration Ordinance, a non-local graduate with the necessary qualifications may apply to the MCHK for approval to practice in Hong Kong by way of limited registration without having to pass the licensing examination. The relevant requirements are A, that he has been selected for employment or for a type of employment determined and promulgated by the MCHK. B, that he has obtained an acceptable overseas qualification. And C, he has had adequate and relevant full-time post-qualification clinical experience. D, he is registered with an approved medical authority outside Hong Kong. And E, he is of good character. Limited registration is valid for a maximum period of 1 year. The person so registered may apply for renewal of registration for another year before the expiry of the limited registration. The hospital authority makes reference to the 1-year validity period of a limited registration as approved by the MCHK in sealing contracts with non-local medical practitioners on limited registration. In the face of challenges posed by a growing aging population and increasing public demand for healthcare services, the government has set up a high-level steering committee to conduct a strategic review on healthcare manpower planning and professional development in Hong Kong. The steering committee will assess the manpower needs of the healthcare professions which are subject to statutory regulation and put forward recommendations regarding future directions of their professional development. The strategic review covers the regulatory framework for healthcare professions, including the functions and composition of the regulatory bodies concerned. The administration will take forward the recommendations of the steering committee as appropriate upon completion of the review. Number 3, established under the Medical Registration Ordinance, the MCHC operates under the principle of professional autonomy. The government provides secretariat service through the Department of Health to support the MCHK in discharging its duties and funds the relevant expenses arising from legal consultation and litigation. Currently, the Medical Council Secretariat has an 18-strong establishment, including those employed on civil service terms and contract terms. In the past 3 years, the government spent an annual average of $24.5 million to meet the daily expenditure of the Secretariat. From time to time, the administration will review the manpower and resource requirements of the Medical Council Secretariat and make corresponding arrangements. Thank you. Dr. Vincent Fang. President, in the past 10-odd years, the MCHK has handled medical complaints, but it has been criticized that it is only standing on the side of doctors. And sometimes even if a complaint has to do with a death, it is only called a misfortune, that it was an accidental death. Now, I'd like to know whether it has the also duty to reduce the number of such complaints by watching over the professional conduct of doctors. I understand it made proposals to the administration 13 years ago, but unfortunately there have not been too many measures rolled out. On the contrary, there are many more complaints. Mr. Secretary, of course, you did not work in the Bureau then. I'd like to ask you about the previous reform proposals. How are they different from the present reform proposals? And what do you think is the greatest barrier to reform, Mr. Secretary? President, first of all, I'd like to clarify one point about what Dr. Vincent Fang said. You pointed out some observations, but those might just be overall impressions. And I'd like to clarify that actually it is not for the Medical Council to make a judgment of misfortune, because this is the duty of the coroner's court. The MCHK will only conduct inquiries into the professional conduct of doctors complained against and then come to a decision as to whether the doctor is guilty of professional misconduct. As to your second question, it is true that a number of years ago, the MCHK made proposals about reforms covering the composition of the MCHK. Recently, as I said in the main reply, The MCHK also made proposals in June in order to increase efficiency of their hearings. In this regard, the present proposal does not include certain proposals made a number of years ago. This time around, with regard to proposals made in June by MCHK, we now have an active or positive attitude towards it. And in fact, we are also asking the MCHK to take another look at the reform proposals proposed a decade ago to see whether the MCHK would also like to ask the administration to handle those and follow up on those in the present legislative amendment exercise. And then the administration will give it overall consideration and also do the necessary follow-up legislative work. President, a point of order. I'd like to have a quorum call, please.
張宇人議員
Mr. Tommy Zhang, your supplementary, please. President, in the main reply, I'd like to refer to part 2, please, of his reply. He talks about those who can be qualified to practice in Hong Kong. Just now, Dr. Vincent Fang said many people criticize the MCHK. It is, of course, because they are peers investigating into one another, and it is like a trade union. It protects itself so that nobody can come to Hong Kong to practice. In part 2, it talks about a 1-year contract. Think about this. These are not unimportant posts. How can doctors give up their own jobs and then come to Hong Kong for just 1 year? I don't think anyone would do that. So, Secretary, when you head this high-level steering committee on healthcare, manpower planning, and professional development, I hope you will look into this. But, Secretary, my question for you is, you talk about approving other people to come and be registered in Hong Kong, but you don't let us know their professional qualification. For example, do they have to practice in a specialty? Because even if they are allowed to come into Hong Kong, they may not be allowed to practice their specialty, but only practice as a general practitioner. Will you target this point so Hong Kong people can be taken care of by overseas doctors? Secretary. President, Mr. Tommy Zhang says we should think of different ways and means to allow non-Hong Kong graduates to come to Hong Kong to practice. I understand that. But then, before he asked the question, he talked about the issue of specialty. I don't think I understood the question completely, but let me attempt an answer. Talking about MCHK registration, there are 2 parts. One, doctor's registration, like a general practice doctor, and another registration is for specialists. These are 2 separate parts. In Hong Kong, if you get general registration with the MCHK, then you can already practice in Hong Kong. So whether you can practice in Hong Kong depends on whether you get the registration for general practice in Hong Kong. As for specialty or specialists, general registration, it has to do with the following situation, and that is when a doctor practices as a general practitioner in Hong Kong, the law will allow or disallow him from claiming that he is a specialist. Because if you want to claim yourself to be a specialist, you must have been registered in an overseas specialist list. That is for clarification. And now I would say that actually we agree, and there is also a consensus, that during this period, especially at the hospital authority, and that is in the public sector where there is a big shortage of doctors, we would also like to facilitate the practice by non-local graduates in Hong Kong, especially if they are actually Hong Kong people who have read a medical degree outside Hong Kong. We hope they can come back to practice in Hong Kong. We are looking into all these measures. That is why you heard us say that we say there should be twice a year instead of once a year for people to sit the licensing examination. And also, we would also like to lower the requirements for attachment. And of course, some people are asking whether the limited registration period can be longer than a year. Later on, at the steering committee, when we look at all medical professionals in Hong Kong, the manpower level and also their professional development, we will also give consideration to all these proposals and then we'll make a decision. But in the first stage, We'd like to, first of all, clarify the MCHK's proposal to make hearings more efficient. We think that we can go for that amendment first because that is less controversial. Dr. Leung Ka-lau, Mr. Tommy Cheung, what's the problem? Well, actually, my supplementary was about the approval for non-local medical graduates to come to practice in Hong Kong, and whether at the same time we can also allow him a specialist qualification. Because overseas specialists may come to Hong Kong, they sit the examination, but they don't know whether they can practice as a specialist in Hong Kong. Mr. Cheung, I heard the Secretary answer your question very clearly. If you still don't understand, maybe you can find another opportunity for the Secretary to explain things to you. I'd like to remind members again, when you ask a supplementary, please do not express your opinions at length, or else I will not be able to ask the Secretary to answer you. President, a point of order. I'd like to have a quorum call, please.
Mr.
Tam, what's the problem? Sorry, speaker not coming through. President, can you consider having a meal break by adjourning the council, or can we bring a meal into the council for eating? Please consider it. Members, please arrange for your meal time separately. Mr. Wang Jingguang, what's the problem? This morning, I came back at 8:30 for a Bills Committee meeting. I have not had breakfast. And now, some members seem to have nothing better to do, and they're already calling for the umpteenth time for a quorum call. This is lunch time. It is impossible to form a quorum. If this goes on, It is bad for members' health. It is not conducive to the smooth conduct of this council meeting. Harm will be done. President, can you not exercise your discretion to deal with this extraordinary time and also make arrangements about these members who abuse the use of rules of procedure so that we can have a little time to have a meal so we can continue the meeting? Mr. Wang, please sit down. I can only act according to the rules of procedure. As for members' meal time, given members' wisdom and your judgment, I'm sure you definitely know what you should do. I know the public are watching the operation of this council. If members act legitimately and reasonably, I think the public will understand. Pardon me for not having wisdom to deal with my own meal times. I look very sad now, but look at the other guy. He is wearing a cunning smile. I have decided we will act according to convention, and I will chair the meeting that way. Members, please decide on your own meal time. From what I understand, the rules of procedure do not stop you from adjourning the council to allow us to take a meal, because I do not know whether I should leave or should stay. On humanitarian grounds, could you not please adjourn the meeting and allow us to have a meal first? You can now go have your meal. The ROP does not say you cannot leave for a meal. But President, I have the responsibility. The meeting is going on. How can I leave for a meal? Because I am afraid there would not be a quorum and the meeting will be aborted. I have a huge sense of responsibility, President. Can't you consider having a meal time? Well, since this is an extraordinary time, as the member said, the members should also try out something which is extraordinary. Try finishing a meal within 12 minutes and you won't have any impact on the meeting. Recently, a doctor reminded me that I should not take my meals fast because it would cause more harm than not having a meal. I'd like just to share with you this medical advice that I received recently. Mr. Tian, if you can go to the toilet twice, you can also eat your meal by separating it into 2 bits. Mr. President, recently you must have heard about the eating habit of Mr. Christopher Chang Wah-fong. Mr. Chang is a very hardworking member, and he doesn't want the meeting to be aborted, so he cannot go out for a meal. But as you know, if he doesn't eat, he cannot stand properly, so he cannot even stand to ask a supplementary. Please show care and concern for a member and his health, because this member is very concerned and mindful of his responsibility here. Please do show care about the health condition of members. I will do that. I can see that Mr. Zhang's condition is in a way better than yours, Mr. Jeffrey Lam.
Dr.
Lan Ka-lau, please ask your supplementary. Thank you, Mr. President. In the main question, Dr. Vincent Fang said that the MCHK looks like a trade union aiming to protect the interests of members of the profession. This is a very serious accusation. I'd like to ask the Secretary whether he has any figures or any science to determine whether this is a true statement. By that I mean in the last 3 years, if you look at the cases at PIC, the figure for the lay members' view and whether it is different from the collective decision of the PIC. Secretary, this question has to do with the analysis of some raw data. If necessary, I can supply the answer after the meeting. I don't have an answer here. I'd like to repeat, in the last 3 years, the difference in view between the lay member and the collective decision of the PIC in both directions. Secretary, I think you are clear about the request of the member. Ms. Elizabeth Quat. Thank you, President. Many members of the public are lining up to see doctors, and the administration also says that there is a shortage of doctors. However, a member of the medical council said in the media that there are many doctors in Hong Kong, there is no shortage. And then this gives the impression to the public that the qualification of doctors is decided by the MCHC and MCHK. As the secretary said, a major review will soon take place. I'd like to know when it will be completed, and how can you break the impression of the public that actually doctors in Hong Kong are just protecting their own interests by not allowing overseas doctors to practice in Hong Kong? Secretary, President, I talked about a review, and it will be conducted by a high-level steering committee on healthcare manpower planning and professional development. It will look at all medical professionals who are to be registered, including doctors, dentists, Chinese medical practitioners, nurses, and 5 other allied professional jobs. And therefore, the steering committee will take time to finish its work, but we will give priority to concerns of the public vis-a-vis where there is a bigger shortage, including doctors and nurses. We will give that priority. We have also with regard to the regulatory framework of doctors, we have also commissioned the CU Hong Kong to do research for us. And when they come back with findings, we will collate the findings, and hopefully we can put forward our view as to the future reform direction. Is it that your supplementary has not been answered? President, the Secretary, please repeat your supplementary. When will the review be completed? We are talking about saving lives. Okay, you don't need to explain further. You just want to know the time for completion. Actually, I think the Secretary has already indicated, but Secretary, would you like to supplement? I have nothing to supplement, Mr. President. Mr. Tam Yu Chung, this high-level steering committee will conduct a strategic review on manpower planning. Does it include dentists? And also, there are some overseas doctors who want to come to Hong Kong to take the examination, but then they think the examination covers a really wide area, and therefore they might think twice before coming to Hong Kong. Will you also look into that? Secretary, President, there are 2 parts. As I said, maybe I did not include dentists. In fact, we cover all medical professionals who have to be registered in Hong Kong, including dentists, therefore. As to the second part, the content of the examination, this will not be included in the present review, but we have been liaising with the MCHK, which continuously reviews the examination. I was mentioning the frequency, arrangement, and also content of the examination. The MCHK keeps that under review. Ms. Alice Mack. Mr. President, the biggest criticism is that the MCHK takes a long time to conduct inquiries, and patients and their families are made to wait a long time. The MCHK is making proposals to, say, for example, increase lay assessors. But would the administration set up a separate complaint mechanism outside the MCHK so patients can have another channel for lodging complaints, including complaints against doctors' misconduct? Secretary, President, Ms. Alice Mack's last line, well, that is something I'm still considering. But if Ms. Alice Mack is also talking about professional misconduct of doctors, then undoubtedly, in terms of the legal framework, this must be the jurisdiction of the MCHK. At present, patients and members of the public have different channels to lodge complaints if they are not happy with medical service. At the public sector, there is a two-tier complaint mechanism under the HA, including a public complaints committee with a composition including lay members or members outside the HA. If it is about private practice, I think most of all it will be about quality of service. For example, whether there has been negligence, that would belong to the scope of civil litigation. Therefore, the existing channels are quite clear. In other words, if it has to do with the hospital authority or administrative complaints, then there is the two-tier complaint mechanism at the HA. If it is professional misconduct, then it is MCHK. If it is a civil kind of litigation, then you can go to the court.
Question number 2, Mr. Jeffrey Lam. Mr. Albert Chan? Before Mr. Jeffrey Lam raises this question, I think we should have a quorum call.
I'll
try to finish my meal within 15 minutes and come back. I'll try, but I'm concerned about your health as well, Mr. President, and I think you should also have your lunch now. Mr. Jeffrey Lam, please ask your question. President, it has been reported that at a meeting of the Commission on Strategic Development held last month, the CE raised the issue of reducing the number of mainland people visiting Hong Kong under the IVS to seek the views of Commission members. In this connection, will government inform this council, A, according to the studies conducted by the authorities, of the feasible ways to control the number of visitors to Hong Kong and the relevant details? B, whether it has assessed in detail the impact of a reduction in the number of IVS visitors by 10% to 30% on Hong Kong's economy and people's livelihood, if it has of the details, if not, the reasons for that. And C, given that the number of visitors to Hong Kong during this year's Labor Day Golden Week holidays has dropped as compared to that in the same period last year, and some members of the tourism industry have pointed out that there has been a downward trend in the spending power of visitors to Hong Kong in recent months, whether the authorities will, in response to the latest developments, revise its forecast on the number of visitors to Hong Kong and the contribution of IVS visitors to Hong Kong's economy for this year. Secretary for Commerce and Economic Development. President, tourism is an important pillar of Hong Kong's economy, accounting for 4.7% of our GDP, of which 3.9% is attributed to inbound tourism. On the other hand, the tourism industry also offers 250,000 direct employment opportunities, of which around 220,000 are related to inbound tourism, and most of the jobs are for the grassroots and with relatively lower skill requirements. It can be seen that inbound tourism contributes significantly to Hong Kong's economy and employment opportunities. The SAR government attaches great importance to the long-term and healthy development of Hong Kong's tourism industry. At the same time, we understand the community's concerns about the impact of the continuous growth in visitor arrivals on people's livelihood. Therefore, we've been adopting a realistic and pragmatic attitude in handling tourism-related issues. Over the past period of time, the SAR government did much work on various fronts for the issue, including an announcement by the CE in September 2012 that the relevant mainland authorities would liaise and work closely with the Hong Kong SAR government to ascertain the receiving capacity of Hong Kong before considering implementing multiple entry individual visa endorsements for non-permanent residents of Shenzhen and arranging the orderly issuance of exit endorsements for non-permanent residents in 6 cities. After that, the SAR government also comprehensively assessed Hong Kong's capacity to receive tourists. Following the completion of the assessment report on Hong Kong's capacity to receive tourists at the end of last year, the SAR government is making great effort to enhance Hong Kong's capacity to receive tourists along the recommendations in the report, including the expansion of the 2 theme parks, the commissioning of the second berth of the Kai Tak cruise terminal, and so on and so forth. We'll continue to adopt a multi-pronged approach to increase the supply of hotel rooms with a view to fostering the long-term and steady development of our tourism industry. The continuous growth in the number of visitors inevitably brings inconvenience to the daily lives of local residents, especially those living in individual districts. Taking into account the community's continued concern about Hong Kong's capacity to receive tourists, the CE indicated in April this year that the SAR government was looking into ways to adjust the growth in visitor arrivals and their composition and would announce the outcome as soon as possible upon discussion with the central government and relevant mainland authorities. On this, we've been listening to and gathering different views from different sectors of the community on the policy for mainland visitors to visit Hong Kong over the past period. In the past 1 or 2 years, there were views from some members of the public advocating reduction in the number of mainland visitors. Some LegCo members even suggested that the multiple entry individual visit endorsements for permanent residents of Shenzhen be abolished altogether and that the number of visitors under the IVS be reduced substantially. We noticed that by making these proposals, these people only aimed for a substantial reduction of the number of visitors without analyzing the impact of the proposals if implemented on the economy. The SAR government has all along been stressing that in considering the issues of visitor arrivals and their composition, we must at the same time analyze objectively the impact of the adjustment measures on Hong Kong's overall economy. Let me provide again the visitor arrivals in 2013 as reference. Out of the 40.75 million mainland visitors, about 42% were overnight visitors, 58% were same-day visitors. The average per capita spending by these two types of visitors during their stay in Hong Kong was $8,937 and $2,721 respectively. The average per capita spending by overnight IVS visitors from places outside Guangdong province even reached $14,311. Therefore, in considering ways to adjust the growth in visitor arrivals, we should not only focus on the number. We must at the same time consider the composition of visitors, including the target of adjustment, the type of visitors, for example, whether we wish to reduce the number of overnight or same-day visitors so as to assess the related economic impact. In the recent month, we began to receive more balanced views, suggesting that we should not handle the problems arising from the number of mainland visitors in an across-the-board manner. Among these views, some suggested that we should work on the multiple entry individual visit endorsements, including making adjustments to set the limit at 1 trip per day, certain trips for endorsement, and so on and so forth. And on the other hand, the government announced earlier that the statistics of retail sales for April this year recorded the largest reduction since February 2009. In addition, there was a drop in the number of mainland visitor arrivals and mainland inbound group tours during the Labor Day holiday. All these developments have made some members of the trade very concerned about the impact of reduction in visitor arrivals on the retail market as well as the overall economy. According to some recent media reports, the owners of retail shops in dump districts indicated that the visitor flow had gone down recently, and they were worried that any adjustment in the number of visitors under the IVS would impact on their business. Meanwhile, the hotel trade suggested that the target of adjustment should not include high-spending overnight business or leisure visitors, or else the impact on the hotel industry would be significant. It is exactly because of the examples mentioned above that we have to consider very carefully the directions towards which to adjust the number of visitors and improve their composition. The central government is very concerned about Hong Kong's capacity to receive tourists and does not want the harmonious relationship between the residents of the mainland and those of Hong Kong to be affected by excessive visitor arrival. The Hong Kong SAR government met with the Hong Kong and Macau Affairs Office on the 23rd of June and relayed different views of the Hong Kong community on the IVS to the central government. The central government has heard the views of the Hong Kong community. The measures to fine-tune and improve the arrangements under the IVS are still being discussed, and there is no conclusion reached at this stage. Therefore, we encourage different sectors of the community to continue to seize the time to have extensive and serious discussions and give specific recommendations. The SAR government will continue to liaise and exchange views of the central government. President, Mr. Deputy, Mr. Albert Chair, sorry to interrupt the Secretary. I want a quorum call. Mr. Wong Ting Kwong, Mr. Deputy. Before you took over the chair, I had said this to Mr. Zhang, the president. I raised the issue of a lunch break with him, and he asked us to make our own lunch or meal arrangements. Now, concerning the members who keep calling for quorum counts. When the bell was ringing, one of the members simply ignored the bell. He was having his meal very slowly in a leisurely manner, and I can show you this photo to prove this, and I think such acts are most despicable. Now, Mr. Wong, as Mr. Zhang has said, members have their own wisdom. They act in accordance with their wisdom. And what they do are for all to see, for the public to see. And I have to point out that throughout the morning, Mr. Albert Chan was absent from the meeting. And I don't know whether he has had his lunch yet. And as soon as he came back, he started calling for quorum counts. And I think he should pay attention to the health of other members. I think members' acts are for all to see. The public are watching us. And Mr. Deputy, does the member who has just asked questions know that there are people who do not have formal lunch breaks? There are people who do not have lunch breaks at all. Please be seated. This is not a time for you to give your comments.
請各位同事係
Colleagues, order please. Please keep quiet.
商務及經濟發展局。
Secretary.
特區政府會
President, Mr. Deputy, the SAR government will continue to liaise and exchange views with the central government and relevant mainland authorities so that the adjustment measures eventually implemented by the central government would better meet the long-term and overall interests of Hong Kong. Thank you, Mr. Deputy. Mr. Jeffrey Lam. Mr. Deputy, the IVS has caused crowdedness in some districts. I understand that residents in these districts are concerned, but I don't think we can ignore or negate the contributions of the IVS to Hong Kong's economy. The Secretary, in his reply, did not tell us the administration's assessment with regard to the impact on Hong Kong's economy if the number of IVS visitors goes down by 10 to 30%. And then how should the multiple entry endorsement scheme be adjusted to suit the reduction targets concerning the IVS? Should we have one trip 50 or one endorsement 52 trips or what? Secretary, I think we need to take into account two factors. First, the number of visitors, and second, the composition of the visitors. Now, for the retail statistics, in April, it fell. We had a figure of 9.8%. And so we have to take into account the impact on people's livelihood. We also have to take into account the impact on our economy. If we adopt an across-the-board approach, then there may be some adverse impact on the economy. We want to avoid fluctuations. We want to see stable development in Hong Kong. We do not want to see our economic figures fluctuating. So we will we hope to receive concrete suggestions from the public, and we'll be having discussions with the central government. My question has not been answered, Mr. Deputy. I asked the administration what the impact would be, and he's merely said adverse impact. Of course, we know there might be adverse impact. I think he has already answered your question. If you wish to follow up further, please do so on other occasions. Mr. Lau Wong Fat. Mr. Deputy, concerning the recent drop in a number of arrivals from the mainland, I understand that because of this phenomenon, the retail sector has been complaining. The retail sector is crying for help. And if the number of visitors is to be reduced by the SAR government, then the retail sector will suffer more. Do you agree? Secretary, Mr. Deputy, it is true that for the April retail figures, there was a drop, and tomorrow the May figures will be published. I'm sure everybody is concerned. And the TDC has just published the number of tourist arrivals for May. There was an overall growth of 10.8%. In May, the number of arrivals reached 4.59 million. And there was a growth of 13.1% concerning arrivals from the mainland. And there was a growth of 21.2% in the number of visitors under the multiple entry endorsement scheme. But then the spending by the visitors has gone down. So we can see that there are new trends with regard to arrivals from the mainland. So we need to carry out studies, we need to come up with recommendations. And so, as I stated in my main reply, we have to look at the number of arrivals as well as the composition of the arrivals. Now, for example, if we're to reduce the number of visitors, should we reduce the number of overnight visitors or same-day visitors or what? And so we need to have a detailed study. Mr. Abraham Sheck, Mr. Deputy, in reply to Mr. Lam's question, the Secretary did not really answer the question. And he merely said that in 2013, about 40 million mainland visitors came to Hong Kong. About 42% were overnight visitors and 58% were same-day visitors. So So did he try to explain why the ratio was 42 to 58, and why was it that so many visitors did not stay overnight? Was it that there weren't enough hotel rooms? Is it that our government is very bureaucratic and has hindered the development of hotels, and that there are many investors who are interested in building new hotels? So can you accelerate the approval process, for example? And can the secretary tell us how many hotel rooms will be completed in the near future? In the past decade, many hotel rooms were provided in the last decade in Macau. And so although Macau is a small place, it is capable of receiving a lot of visitors and tourists. Secretary, Mr. Deputy, in fact, I thank Mr. Abraham Sheikh for his concern. In the past decade, the number of hotel rooms increased from 38,100 to over 70,000 in 2013. So the increase was 84%. So the increase in the supply of hotel rooms in the past decade was very substantial. And in the coming years, the number of hotel rooms will increase from 70,000 to 84,000 in 2017. And so we will continue to liaise with stakeholders, including those in the hotel industry, to monitor the supply and demand situation. And then as to what we've done to increase the supply of hotels and hotel rooms, now we have hotel-only sites made available, and that started in 2008, and we are revitalizing industrial buildings and also some historical buildings. For example, in Shek Kip Mei Hall House has been turned into a youth hostel. And then, as members are aware, we have 2 theme parks, and the hotels will be expanded, and by 2017, a total of 1,200 rooms can be provided by the 2 theme parks. And then in the Kai Tak runway area, there will be a hotel belt, and there will be 6 hotel sites, and from the end of 2015, these 6 sites will be launched, so to speak. Mr. Gary Chen. Thank you, Mr. Deputy. I hope that some adjustments to the multiple entry endorsement scheme can help combat the problems caused by parallel import traders. But I'm worried that the adjustment may hit the parents of children living in the mainland who have to cross the border to come to school, and because they have to accompany their children to Hong Kong and from Hong Kong more than one time a day. So do you have such figures? And will you provide an exemption for parents of children who study in Hong Kong, who have to cross the border to come to school every day? Yes, Mr. Deputy, I thank Mr. Chen for his concern. Now, in fact, when we look at the number of arrivals and the composition of the arrivals, we are not merely targeting the parallel good traders. Parallel goods trading is an activity that the Customs and Excise Department seeks to combat. We are now looking at the impact of the IVS on people's livelihood, and we have to balance that against any possible impact on our economy. And so concerning the multiple entry individual visit endorsement scheme, we have to consider these cross-border activities, these cross-border movements. And as I've said in my main reply, we haven't come to a conclusion yet. We need to consider who will need certain facilitation measures with regard to cross-border movements. Yes, Mr. Cheung Hwa Fong. According to the administration, Mr. Deputy, concerning the IVS, there is a need for the SAR government to hold discussions with the central government and the relevant mainland authorities. Last week, the CE met the Hong Kong and Macau Affairs Office and the Public Security Bureau. Did the CE reflect worries in Hong Kong about a reduction in the number of IVS arrivals to the central government and the relevant authorities. And will the government consider encouraging more mainland tourists to come during the off-peak seasons? And will you also consider encouraging more tourists to come for certain activities with local characteristics? Yes, Mr. Deputy, I thank Mr. Zhang for his question. Under Article 22(4) of the Basic Law, for mainlanders coming to the Hong Kong SAR, they have to get approval first. And in fact, the NPC-SC gave an interpretation in 1999 specifying that for mainlanders who wish to come to Hong Kong for any purpose, they had to apply beforehand. So this is the central government's policy concerning the working meeting with the Hong Kong and Macau Affairs Office last week. Public Security Ministry officials were also present at the meeting. There was an exchange of views on a number of issues. Some Hong Kong people are of the view that we should have a 1 day per trip individual visit endorsement, and so such suggestions were also discussed at the meeting, but then our discussions will still go on. We haven't come to a decision yet. And concerning inbound tourism, we will discuss with the tourism board ways to promote tourism during the off-peak seasons so as to further promote inbound tourism. Ms. Priscilla Leung. No, in Hong Kong, Mr. Deputy, there are people holding different views. There are some who consider mainland tourists as locusts. They want to drive these tourists away. But then there are many people, Hong Kong people, who are very friendly to our tourists. Mr. Deputy, I want a quorum count.
梁美芬議員。
Miss Priscilla Leung. This is not a playground, Mr. Deputy. I've received a few SMSs. These are members of the public. They are of the view that they want to hear the complete questions from members and the complete replies by the secretary. Please ask your question. Yes, Mr. Deputy, people are very concerned about IVS. Many in Hong Kong are against the idea of calling mainland tourists locals, insulting them, trying to drive them away. Because if the harmonious relationship between Hong Kong people and mainland visitors is harmed, it will be difficult to repair such ties. And there are people who choose to insult mainland tourists, and as a result, some mainland tourists may not want to come to Hong Kong anymore. So is there a policy where we can do the following? In other words, when the mainland visitors arrive in Hong Kong, they will be told Hong Kong's culture. And second, can the administration do some promotion in Hong Kong, advising Hong Kong people not to be hostile towards mainland visitors? So I think can you try to deal with such hostilities between mainlanders and Hong Kong people? Secretary, Mr. Deputy, Hong Kong is Asia's cosmopolitan city. We welcome people here to spend their leisure time and to do business, and we hope that they can have a happy experience during their stay in Hong Kong. And concerning the so-called anti-locust movement and similar movements, they will cause resentment among mainland tourists. Now we are now looking at how to adjust the number of mainland visitors and the composition of the arrivals. I believe mainlanders know that it is not that Hong Kong doesn't welcome them, but then our receiving capacity is limited, and we also have to make sure that the development of our tourism industry is healthy and sustainable. And so in future, SAR government will continue to boost Hong Kong's capacity to receive tourists, and we together with the tourism board will continue to promote Hong Kong's image as a place of hospitality. Mr. Deputy, I want a quorum count. Mr. Albert Chan. Mr. Deputy, I want a quorum count. Mr. Albert Chan. I think if you want a quorum count, you should do so after the official has finished his reply. Please do not interrupt the secretary when he's speaking. I want to clarify with you concerning the rules of procedure. Yes, I know what the rules of procedure say, but can you call for a quorum count after a member or an official has finished? Mr. Deputy, I do not know when he's going to finish, and I think the lack of a quorum is a very important issue. And in fact, I rushed in. I thought his reply would be very important, and so I rushed in and I discovered that there wasn't a quorum. So ring the bell, please.
梁美芬議員。
Miss Priscilla Leung. Mr. Deputy, I've received this SMS from a member of the public. Stupid, 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 the SMS says. And so, for those who are concerned about this issue, I hope they can come in so that the member can no longer call for a quorum count. Many people are really concerned about IVS. Now, yes, many people are concerned about this issue, but then there are members who feel totally indifferent. But I believe the public know that very well.
救人。局長。
Secretary. No, in fact, I was about to finish. Only one more sentence. The tourism board has been making use of traditional ways to promote tourism, and also apps and also internet. The internet have been used to promote the hospitable culture in Hong Kong. Miss Priscilla Leung, I asked a very specific question because not all visitors use mobile phones. So now if we go to the Middle East, upon our arrival, we are reminded of the taboos there. So will something similar be done in Hong Kong at our border crossing points? Secretary. In fact, I did say something about pamphlets.
The third oral question, Mrs. Regina Yip. Thank you, Mr. President. The Hong Kong Fire Services Department